Welcome to Hope for Med.
Hope for Med. Hi, everyone. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Laxmi Naik. She is an ER physician located in Atlanta, Georgia, who is the owner and CEO of a holistic medical practice called Spectrum Integrative Health. Welcome to the show.
Thank you. Thank you for having me.
So, Dr. Naik, I love hearing people's stories. And so I love starting these podcast recordings from the very beginning. So can you share with my listener your origin story?
Yeah, thank you. I loved medicine since I can remember. I knew in high school I wanted to be a physician. I loved the whole healing aspect of the journey. And I just loved talking to people, and I loved biology and all that good stuff. So, ended up doing medicine in New York, and then chose to do emergency medicine for my residency. And I trained in New York. We moved down to Atlanta in 2006, and my husband got another position. Came here and practiced ER for about 7-8 years. And then, had some personal health challenges. And I come from a tradition where, holistic wellness is the initial go-to modality. You watch your diet, you do some herbs, you sort of, do mind-body stuff where you do yoga, meditation, breath work. And that's how you initially try to heal. So when I started having some health challenges, I was in the middle of an emergency medicine shift, and my legs went numb. There was a lady literally having an MI in front of me, and my legs were numb. And I called the other attending that was on staff with me, and I said, "Can you just cover for me? Something's really going wrong with me." And they got someone to cover my shift. I went home, and I'm thinking doing my differential diagnosis kind of workup in my head, and I actually ended up sending labs on myself. And I said, okay, let me start doing my own workup. And so ended up, started having some autoimmune symptoms, and went to, my traditional rheumatologist who wanted to put me on some heavy dose stuff, immunosuppressants and stuff. And at that point, I had a choice to make as to what road I'm going to walk down. And, there's, Western medicine is evidence-based scientific approach to healing the body. They do trials on medications. They take patients with a certain disease, and they do studies and see how many people get better with that drug. Now, no one's ever really done studies with, hey, are these herbs going to help? Is this diet really going to help in this cohort of people with autoimmunity? Because, it's not a revenue generating kind of structure. So at that point, when my doctor, I said to him, you know what, I'm going to really sit and think about this. For some reason, energetically, this just doesn't feel right. And so I went home, and I started researching and reading about, well, what do you do, gluten-free diets, and, what herbs do we use, for decreasing inflammation? Like, is it turmeric? Is it, ashwagandha to, improve my adaptogenic system? All of this, I just started reading about it, and I was just fascinated. It just pulled me in. And I said, wow, this feels right. This feels really right to me. I would just go stand in the sun, would do grounding, put my feet in soil and feel the earth. And it just started feeling like I was coming home to myself again. And there the journey started with my training. I trained and I got board certified by the Association of Integrative and Holistic Medicine. And my interest was piqued further. And the Western approach to integrative health and healing is more sort of functional medicine, which is we test biomarkers, genetic testing, those sorts of things, hormones. And so got certified by the Institute of Functional Medicine as well. And come full circle, I think I was diagnosed with autoimmunity in about 2017. And come full circle, following this path and studying all this stuff, I no longer have an autoimmune illness. So,
Oh, wow.
yeah. Yeah. So really reversed myself fully on my own. And it's been such a journey along the way. I've met fantastic consultants following this path, other colleagues sort of, delving into the science of this. So I finally said to myself, you know what, we've got to do something. I'm going to start this, and started the practice, Spectrum Integrative Health. And the origins of that name are also interesting. I have a son with autism. So he's on the autism spectrum, and he was also sort of my inspiration to pursue this path. So I called it really after him, Spectrum Integrative Health. Integrative because I am conventionally trained and I am integratively, holistically, functionally trained. And so I like to blend the two. So, yeah, my patients come to me because they're looking for those mixed modalities to get better, because conventional medicine has not been serving them. It's a symptom-based approach to treatment. So if I have high blood pressure, the doctor gives me blood pressure medication. If I have asthma, I get some sort of an inhaler or a steroid inhaler to suppress the inflammation. There's no approach to, and there's frankly, no time for the physician based on the reimbursement model to sit there and tell the patient with hypertension, hey, you need to lose weight. Hey, you know what? This is the diet you really need to be on, potentially low salt diet, DASH diet, to reduce your, hypertension. They will refer the patient to a dietitian per se, and we don't know what the follow-up of that is like. And so there's not that approach to say, hey, let's start with foundational stuff. Are you walking? This is your diet? Are you doing this? What's the blocks to you not doing this? What can we put you on? And honestly, the herbs and all of the additional supplements, I would say probably can get layered in later, but the foundational stuff is very, very important. And when the patient hears it from the physician, it's a very different story. It's a very different dynamic in terms of coachability and their ability to perceive the importance of it, and so yeah, I do the foundational stuff, and then we add on, targeted supplementation as to, what will get them better. And usually, they turn around in let's say about 3 to 6 months, depending on, how severe they are. So that is my story.
So there's a couple of things that you mentioned in your story that are really interesting. One is that you are cured of the autoimmune disorder.
Yes.
In medicine, there's a lot of things that, not even a lot of things, there's a limited amount of things that we actually successfully cure. We manage a lot, right? But curing, is one of those things that the infectious disease doctors say. Well, I love infectious disease because I give this antibiotic.
You cure them, yeah.
And you're cured, right? So how did you cure yourself of this autoimmune disorder and not have to be on steroids for forever?
Yeah, exactly, right? Because, the approach to integrative medicine is what is causing your autoimmunity, right? Why is your body turning against itself? Autoimmunity, like it's attacking your own cells. Why is that? Is it because you're exposed to too many toxins? Is it because you're exposed to a foreign substance, potentially reactive? We don't know what that is. We have 1,000 different things in our gut. That now your body has a cross reactivity to you, and you're attacking your body. And so instead of just saying, hey, here's some steroids, let's suppress it, functional medicine and integrative medicine says, hey, you know what? And by the way, naturopathy, Ayurveda, Chinese herbal medicine, all the traditional Eastern arts always start with the gut, no matter what. They always start with the gut. And they say, okay, well, let's see if you need some reinoculation. Let's look at the gut microbiome. Let's see if the bacteria, we're more bacteria than we are human per se, whatever that is. But, is her gut bacteria balanced? Is that why, does she have any food allergies that are very severe that's preventing her from absorbing nutrients? And she might be micronutrient depleted. None of these questions are really asked. And so that's where my interest was. Let's look at the cellular stuff. Let's start looking at the cellular structure. It just wasn't available in Western medicine. And, coming full circle, I'm proof that this is possible. there's also the question of hormones, which were not really deeply addressed by my traditional OBGYN or my primary. They just didn't know. Mm-hmm. And, as we age, obviously, as women and menopause and our, estrogen, progesterone, well, there's a pattern to your estrogen, progesterone when you have autoimmune disease. So they weren't really sure. I just never got answers on, well, why am I feeling foggy? Why am I feeling, confused and just weak and tired all the time? And, you can balance the gut microbiome, you can balance your hormones, and you can actually have, great energy and feel vibrant. Mm-hmm. So, it was layering in the nutrition. I got rid of gluten in my diet and dairy and a lot of other allergenic foods that were not good for me. Then I layered in testing my microbiome and balancing that out. And then I also helped, kind of balance my hormones out. And kind of a combo of all of this, and each person's different, of course, but kind of got me on the path to, recovery, which the tools were just not available in conventional medicine.
Mm-hmm. So question, you're a physician. Of course, this was taught in medical school.
I'm sorry?
I said, you're a physician. Of course, this was taught in medical school, right?
Actually, no. In medical school, how much nutrition training do you get? Mm-hmm. Almost nothing. You don't. It's just not taught to physicians in terms of nutrition. And it's, I have to say this because, it's like the big elephant in the room. Pharma is a very revenue-based industry, right? So you're not going to make money on turmeric, right? Now, the question now is, we do have supplements that we're selling, and supplements do make a huge income, but that's not really as revenue generating a model, right? Like as pharma is. So there's a control there also that's happening in conventional medicine that we're not, open to allowing these modalities in. There's that piece.
So what's the goal? Sorry, what's the goal of traditional medicine? I mean, what's the goal of medicine in general? Isn't that to take care of the patient, to cure the patient, to improve their life and, livelihood? No?
It is, absolutely. I just think that, because of all these factors, whether it's revenue-based, whether it's the approach of the Western mind to say, hey, I need evidence-based medicine, right? I need scientific studies. You're not going to get large-scale scientific studies on, hey, does turmeric heal autoimmune disease? Do we have, randomized double-blind control studies to show turmeric? We don't, because we can't isolate that. There's so many different factors happening. But with this one drug, we can do double-blind randomized studies in Western medicine, which is science-based. So is it approach to healing scientifically? Is it, a revenue-based issue influencing the system? And 3, we just haven't been taught. We just haven't been taught. And so you bring all that together, there are plenty of wonderful physicians on conventional medicine and wonderful physicians in integrative. Each just has a different exposure. We are our training, right? Like I'm not, if you tell me to do a spine surgery, I'm not trained in that. I'm trained in ER. That's what I was taught. So it's a combination of all those things. So, intention is only as good as the tools that you have to carry out your intention. Otherwise, it's just, in your head. Mm-hmm. So I think that's a challenge in the industry. And hopefully with time, we'll get better. Functional medicine is integrative functional medicine is getting a lot of traction now. Mm-hmm. The need for functional medicine doctors across the country is huge. Mm-hmm. In terms of a conventional model, Cleveland Clinic has a fully operating functional medicine center in terms of a large institution. Mm-hmm. Majority of them are private practitioners running their own private practices like me. But, it is getting quite a bit of traction because we are seeing it in our patients. And we're saying, just covering up symptoms is just not going to work. Not going to work. Patients are not getting better fully. That being said, I have patients that are autoimmune that are on steroids and immunosuppressants. And guess what? We do all this lifestyle stuff and holistic stuff. And believe it or not, they need less of their immunosuppressants, but we don't take them off it. Mm-hmm. If they need it to get better, they do. But this is somewhat of a medium middle road, I guess, middle way to do this, It's not all or nothing, black or white. It's just we all need to sort of have these conversations and approach this, in an integrated way and what's best for the patient. And we also negotiate with the patient. It's their life. They have a choice to, make in how they want to, approach their healing. And, I present all options to them and then we proceed. You're not going to get the evidence in Eastern medicine as much. Just because of the approach, Eastern medicine approaches healing from an energy perspective, and Western medicine sort of approaches healing from an evidence perspective. So it's just a different approach. But yeah.
You mentioned something about putting a Band-Aid on things and patients not getting better. If you would allow me to take you back to your life as an emergency medicine physician, what was that experience like for you?
It was very gratifying when I was doing it, because you see such a wide range of medical issues come through. You have to stabilize as well as potentially treat patients, right, in the ER. And it's amazing. You become this incredible clinician, and you, not just academically, even energetically, like you can sniff that, EMS bringing that, stretcher in. You're like, that person, level 1 needs to be in this room. You can sniff the MI from like across the ER. You just look at that lady and she's going to be admitted. This intuitive sense. You just get intuitive. You don't even need to look at the chart. You just
It's like they just call it in. It's like, 85-year-old chest pain. Yep, admitted.
Right? You just know. And then the repeat offenders that come in, and it just becomes like your neighborhood, It's beautiful because I think ER docs are incredible clinicians. And compared to many other fields, they are frontline. They see it all. They do it all. They know so many different diseases. It's incredible. So I loved emergency medicine. That being said, when my legs went numb and as the years went on, I found it definitely challenging. And, I felt that sense of burnout. I had 2 kids. I was working full-time ER. And nights, it was hard on my body. I would come on shifts where, there would be nursing shortages and, 20 people waiting in the waiting room, and all beds full. And, the story. So it's tough. You're supposed to now perform at this level where you're supposed to be on your game. You're being now reviewed by patients and the offices. You're also at the mercy of the ER group that's contracted with your hospital. And, my journey was to be there to heal and to work and to, get these patients better. And, I enjoyed my profession for sure. But given my medical challenges and the logistical challenges of the career caused me, I think, to make that shift. But yeah, I loved emergency medicine. I still do,
The logistical challenges of the career, dissecting that a little bit more. If we keep going back in time, now we're going back to residency. Your experience in residency, how was that different than your real life experience as an attending physician?
Yeah, I think attending in the ER, you mean, or?
In the ER.
Yeah. I was in a community-based ER, so I didn't have residents under me. It was all just me making a lot of the decisions. So,
No. When you were in residency, so when you were training as a resident, working side by side, you're attending, and now you've graduated and you are the attending.
Yeah.
Did you know what were the differences in that?
It's interesting you asked me that. I feel like the differences were essentially just obviously more autonomy, right? I'm making the decisions, not the attending. Being a resident, the first, second, third year, I was in a 4-year program. So obviously I was chief resident my 4th year. So I did make all the decisions that the attending did, and the attending just sort of signed off. That was fine. But the first 3 years, I was a student, right? I was just learning, running around, seeing a lot of cases, you think you know it. And of course, the attending that's been practicing for 20 years just sniffs out some random diagnosis that's like, what? That's porphyria. I'm like, porphyria in the ER? It's like, whatever. You'll get these like, red herrings that the doctors know about. And the hospital I practiced was community hospital, was phenomenal. Long Island Jewish Hospital. If anyone's listening, it's the attendings were phenomenal. We were across the street from a nursing home. So, like literally like every organ system was like affected coming in, And so my training I thought was excellent in that hospital. I learned a lot from my attendings, and I think they, really humbled me that, every time you think you really just don't know in the ER. Every time you're like certain about a diagnosis, there'll be something in the patient's history or the labs or something that just surprises you. So I love the part about learning from my attendings when I was a resident. And the transition to me becoming my own attending, I tasted it when I was chief resident. So it was me and one other person that was two other people that were chiefs that year, sorry. And so we had, I think, about 20, 25 residents that we were managing schedules for, shifts for. And so I kind of got that taste of, being an attending, I guess. And when I transitioned to being my own attending in New York as well as Atlanta, was more of that. I felt more confident about my decisions given the training, but it was also a little bit sad because I lost the community a little bit, when I'm working the ER shifts, it's just me. And so I didn't have my resident colleagues or my other attendings to bounce stuff off of. So I missed that academic piece. It became like all clinical, in a way during the shifts. So it was a little bit more isolating, and it was a little different. It just took time to get used to, but it's pretty amazing that, this 4 years of residency just trains you to, handle so many different things. It's exceptional, actually.
Even with that, you have this really steep learning curve afterwards when you don't have the attending to say, right? You agree, right? It's like, no, you have
there's no backup. It's just you.
Yeah, there's no backup. But part of the reason why I asked that question was, so as a resident, I also went to a 4-year program, but as a resident, you're working side by side, you're attending, and you're seeing some of these things that you mentioned that really cause a lot of, grief, in terms of staffing shortages, in terms of holding, in the ER. The question is, how did that affect you differently as an attending than as a resident? Because some of those things were still happening as you were a resident.
You're right. I mean, I don't know. It's just maybe youth, and it's just youth. I mean, a lot of times also we're not taught the business of medicine as residents or medical students, right? We're just not taught the business and operations and administrative ends of things. And even in residency, I mean, how much training do we get on operations of the ER and, bed availability and things like, nursing shortages, staffing shortages, all those things. I mean, nothing, you just, as a resident, I just sort of worked, did my shift, it's like so many shifts, you don't know what else to do. You're barely sleeping in residency. And so, you just do your shifts and go home. It's almost like you're not taught, so you don't know. It's kind of like the training with integrative medicine. I'm like, my God, they taught us nothing about nutrition in medical school. So how would I know? I just didn't know. And so once I'm in it, thrown into it, and it's all me, it's just, I have to learn. And then I was like, wow, this is the real world. This is no more protection around me. It's just me with all this issues and admits and staff and fighting attendings or, for admission or this or that. It's just me. So, we're just not taught, I think, or exposed unless things have changed.
I also did not get exposed. I think I actually did I created a lesson for my colleagues when I was a resident, I think a 3rd year, that was entitled The Business of Medicine. I think it was a theme day. Yes, I had a theme day that I did the business of medicine and about charting and billing and things like that. But but that's about as much. And I taught myself that so I could teach it to others. But yeah, but it's definitely not something that's highlighted. And the effects of the shortages of boarding and things like that on us in terms of compensation, in terms of metrics, in terms of throughput, and all those things.
Yeah. I mean, that even picked up after I, left ER in terms of reviews and RVUs and, all of that. And also when you're doing your chart as a resident, you're documenting the clinical piece. You're not really knowing the other end of the piece where the billing is happening from the ED side to the insurance. You don't know the level of billing, the ICD codes. You don't know any of that happening. Mm-hmm. Well, guess what? When you become an attending and you're not, documenting correctly, and they're not able to bill based on your documentation, all of that, you'll hear about it from your administrator. You'll hear about it from, the CEO of the group, et cetera, what you're bringing in, what you're doing, what you're documenting. Well, your documentation cost us this much money in terms of revenue. Mm-hmm. So you'll hear all of this, but we never heard it. We never heard it as a resident. So just didn't know. Mm-hmm. So I think that would be phenomenal if someone would incorporate that into the curriculum, because, I didn't know how to negotiate a contract when I left residency. No one taught me. I had a couple of groups I was considering, and I'm like, well, what do? You're going to cover this? You're not going to cover tail? Or, what's the non-compete like? No one really told me anything. I looked at the contract and I ended up calling a bunch of my friends and saying, hey guys, what do your contracts look like? Mm-hmm. And I guess I need to talk to a lawyer, but lawyers are expensive,
That's true.
And I'm coming out of residency with like all this debt and, so it's, it was just, I think, a lack of training and knowledge in that area that made it, different and difficult, I think, coming out.
And the thing is that it's not like you're not being taught anything. You're being taught so much other information too. But some of these key practical life skills, foundational stuff that you need to survive life after being a learner for so long, that's the part that's lacking.
For sure. And yeah, I mean, having done all of it, like seeing all of it, the entire industry, I look at the plug points where they need to happen, and your podcast is Hope for Medicine. So it is that, right? If we're more informed as physicians, as, attendings or coming out into the world, we'll know how to navigate all of this better in such a way that we'll decrease the risk of, defaulting on a contract or leaving, causing a headache down the line with this practice or this hospital or that hospital group, because we'll know what contracts are being put out there. Mm-hmm. So, yeah.
I've said this before in terms of the benefits of a podcast like this for the learners is that they're able to enter into the field of medicine with their eyes wide open.
Yeah.
By listening to other people's stories and experiences, highlighting these things about like, I didn't know how to read a contract. Like, what am I supposed to be looking for? What's this non-compete clause? What exactly does that mean? What are these consequences that I could endure if something goes awry? All of these, you piece all these stories because all of my guests have highlighted different parts and different pieces of this puzzle that, somebody listening will really be able to be very enriched from these conversations.
Yeah, no, it's much needed. It's much needed. It's almost like we need to have some sort of a roundtable discussion with all of us and, figure out what needs to be done. Yeah, definitely. Absolutely.
So another interesting thing about your story that I want to talk about a little bit more is you were in the middle of your shift when your legs became numb.
Yeah.
And what did you do? Did you check in as a patient?
I didn't. It didn't seem acute. Like it wasn't like an acute MI or a stroke, I was like, it's bilateral. I'm like, okay, hard for stroke to present bilaterally initially anyway. But anyway, so like it's bilateral symptoms. There was actually no actual deficit in terms of sensory sensation. I was doing my own neuro exam on myself and I'm like, everything looks fine. And there's actually no deficit, even to, pinprick or whatever. And I'm like, but I feel numb. There's a inner numbness sensation that I'm having, but it's not objective on the exam. So, I waited. It's an ER. So I called my attending over. I said, hey, my legs are numb. Something's wrong. I'm not sure what. Can you cover? And he covered, and we called, backup, person in. And then I went home and went to my own physician the next day and did my own testing as well, blood testing. And he wasn't sure what this was. And my titers were very high for ANA. And ultimately, et cetera, et cetera. That's what happened. But I think, the stress of emergency medicine was definitely, I think, a contributor. I was really tired. I was working long hours. I had 2 kids at home. My older one had autism, so he had a lot of needs as well that I had to attend to. So I was just really burnt out. Like I was really working, around the clock. I'm sure that did not help, sure that shot my immune system as well,
That's right.
So, everything happens for a reason. Just to make it a little more interesting, I find they still couldn't figure out what autoimmune disease I had. They ran tests and tests and tests. They finally ended up referring me to a Johns Hopkins neurologist who's this genius man who ran some titers on me. And apparently I have a 1 in a million autoimmune disorder where I make autoantibodies to my potassium channels.
What?
Yeah, it's 1 in a million.
Hold on. So what awakened this autoimmune disorder, right? Because you didn't just start developing potassium channels later in life, right? So what was that trigger that, made it happen?
Right. So, typically with most diseases, right, it's always a 2-hit hypothesis, right? It's genetics and environment. So the question is, at this point, obviously nobody in my family has this 1 in a million genetic disorder. And I certainly did not have it, most of my life. The question is what happened? And so the root cause is where I think integrative medicine helped me to say, okay, is there a trigger? Is it diet? Is it some toxins in the environment causing this? Obviously, that's impossible to isolate because we're exposed to thousands of toxins a day. But can I minimize certain processes in my gut and look at my gut for healing and say, are there things that I could improve that are in my control? If my microbiome is off, do I increase certain amount of insoluble and soluble fiber to help motility? If there's inflammation in my gut, which you can test, fecal calprotectin levels, certain things, they're markers. If there is inflammation, how do I now create an anti-inflammatory diet for myself? And am I short enzymes in my gut? If so, do I add enzymes to help the digestive process and to absorb my nutrients better to heal? The body needs nutrients to heal. So therefore, I addressed what I could address, right? And when I did that definitely got my symptoms better. Because I chose not to go the other route of, immunosuppressants and Plaquenil, et cetera, et cetera. My neurologist, who found this,
1 in a million.
Because of the numbness, they sent me to him. And so he found this, he goes, well, there's one entity that causes this level. And there's I think 100 women in the world with this. And I'm like, oh my goodness, of course it happens.
It's special.
I'm like, what, 100 women? And he goes, I think he said something like, basically this disorder is highly studied at University of Pennsylvania and blah, blah, blah. And, he's quoting all these studies and stuff. And I said, you know what? He was really amazing, though. I said, look, I've chosen this integrative route. This is what I'm going to do. There's no evidence for this. But in general, for autoimmunity, this is what's done in the East. And this is the approach in functional medicine and stuff. And he was very open to conversation. He said, well, you're functional. Yes, you have this numbness. Let's try it. Let's see. Can't, it's not like an acute situation where we need to, throw high dose steroids and stuff on you. You're functional, you're eating, you're sleeping. Yes, you're walking around with this, numbness, but let's try it. And so he worked with me. He was very open. He did all his stuff, which is the MRI, LP, all the other tests. But he said, let's try it, and he let me kind of And my rheumatologist as well. He also said, I think, you're reasonable in your approach and what you're explaining to us. We don't know what you're talking about, but we trust you and we'll work with you. And, we'll keep track of your blood work and see if you're worsening, but we'll let you kind of do this integrative round and see if it works. And thankfully it did. So yeah, that's where.
So how soon after being diagnosed with this autoimmune disorder did you transition out of working in the emergency department?
It's pretty much, I would say, over a 6-month period.
Mm.
Yeah, I was in that period. I said, you know what, I had to come to a decision, and I internally made the decision. And then it took a couple of months to figure out, well, where am I going to work? What am I going to do for my income, and try to figure out the logistics of everything. And that took, just a few months. Everyone understood. Everyone was very supportive. And it felt right. It actually felt very right to leave at that point. I felt like I had given, I think, overall 17 years to emergency medicine before I left. So, I still talk to colleagues on the front line. It's such a deep passion of mine, emergency medicine. So I still keep in touch with everybody and see what's going on. All my colleagues were frontline in New York for COVID.
Yeah.
Yeah, all my friends. And so that was a really deep moment in time for me because, almost all of them were frontline during COVID, and we lost one friend to COVID. So it was it's a deep love, but it's also a point in my life where I had closure from practicing ER. And having seen this integrative side and the way I healed and seeing other patients heal with me, it's just very tough to go back. Philosophically, it's very tough to go back because I just don't practice that way anymore.
Speak more about that. What do you mean by philosophically it's tough to go back?
When I know this other side exists, so if that patient with hypertension, for example, it's in the ER, maybe if it was out of control, or in primary care office, I would probably give him some hypertensive medication, right? And try to get his hypertension down and follow him for that. But with the integrative route, I can say, hey, take your blood pressure medicine, but you know what? Let's get your weight down. Let's work on your diet. Are there particular herbs that we can potentially use to decrease your blood pressure? And, for my cholesterol patients who don't want to be on statins, they're always thrown statins, which have huge side effects. Can I put berberine, red yeast rice on them and titrate that and see if their cholesterol profile improves? But then you're exchanging a medication for a supplement. So that's not my goal. My goal is, it's still the same approach, right? So if they are on a medication, I say, let's do all the foundational stuff first. Let's work on that. And then we'll do additional testing to check your gut microbiome and food allergies and any other targeted testing that we need. And then we'll say, okay, you know what? Let's try these supplements and herbs potentially. If you're having side effects with the statins, let's try this. But that option is not available in the conventional route. That's all. It's hard for me to go back to that because it's just, I don't practice that way anymore.
And how long, are your visits with your patients to be able to even have these conversations?
Yeah. So my first visit is, I don't take insurance. So it allows a lot of time. I typically spend an hour in the first visit, an hour in the second visit to go over everything. The second visit is about 3 weeks later, 3 to 4 weeks later. And depending on the acuity and the level of intricacy and the medical issues, typically it's about 4 visits a year. And the second year, it's about 2 to 3 visits until they normalize. If they're more complex, I see them regularly, probably once every 2 to 3 months consistently until markers are stabilized, they're feeling better. And it's such a team approach, in terms of creating a relationship with the patient, trust, negotiating, explaining everything. And so they feel like they have ownership of their journey. It's truly how medicine, I think, was meant to be practiced, because I'm there. I never function as the healer. I function as a partner in their healing journey that they dictate. based on the knowledge that I share with them. So, it's sort of that way. We sort of walk the path together. And it's beautiful because they get better, and we have very good, numbers in terms of symptom. We have an MSQ score, so it's a medical symptom questionnaire that we actually have on patients. What are your symptoms when you first present to me? And at 6 months and a year, let's look at those numbers. How are you feeling? And we track those numbers very carefully to see if they're improving, instead of just saying, oh, I feel better, which is a very nebulous answer. We look at actually, system by system, how do they feel? Headaches better, migraines better, bloating better, joint pains better, vision better, whatever. We actually track every single thing, every metric. And we see that with the integrative approach, they're better. They're much better.
I guess in closing, do you have any pearls of wisdom for our listener?
I do. I guess, I was going to say this before, which is that, each of my patient appointments begins with, I ask the patients, would they like to begin the appointment in silence with some breath work, chanting, yoga, prayer, whatever they wish, because I think what's missing in medicine being practiced today is a very disease-centered approach to a patient. And really, the patient is a spiritual being entity first, right? They're a human, they're a being. They're not their disease, right? The disease is something that they have. It's not something they need to identify with, right? So the approach is very different when you look at the person holistically, that they're a spiritual being. And the patients are truly remarkably, they don't have to believe in God or a higher power or anything. Mm-hmm. They're just sometimes super happy just for 1 minute, and literally 1 minute of just silence. So we begin the appointment sometimes with just silence. And then sometimes they just want to breathe. And so this just tells us the level of, stress and distraction and, overwork, overtired society that we are, that we don't even have time for a minute to stop and rest and breathe, some of us, right? So it's, I would like to say that, blending the East and the West is the most beautiful way to practice medicine, and to look at each patient and look at each patient as a human being, as a spiritual entity, as somebody who has, a presence, not just a diagnosis.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.